Hello friends, today we'll discuss previous year questions. So first question is HIV positive patient with CD4 count that is 20 cells with complaints of headache, mild neck stiffness, weakness and suspected meningitis and lumbar puncture show east with no pseudo hyphae. Okay, so this is a question. So answer you can make it clearly. So what's the clue given here is, so first he's a HIV patient, so immunocompromised. Second, he is having the signs of meningitis. Third, the lumbar puncture usually reveals a no pseudo hyphae, right? What happens is, so here lumbar puncture shows no pseudo hyphae. So if there is a pseudo hyphae, there is a chance of candida. Okay, that too it is an okay, but here there is no pseudo hyphae, so the candida is ruled out. So next point is, here they have given clearly about the meningitis, right? So the stiffness, neck stiffness and headache, everything. So usually remember in HIV patient, that too in the CSF, because lumbar puncture has been had done and CSF has been examined, so it shows no pseudo hyphae. Then obvious it is in cryptococcus. Okay. So always remember, if there is a pseudo hyphae, it is in candida. If there is no pseudo hyphae and there is a HIV patient and presence of meningitis, and this it is in cryptococcus. Okay. So second question. So young man aged 30 years presents with difficulty in vision in the left eye for past 10 days. Okay. So here next is, he is immunocompetent and he is a farmer from a rural community, and history usually shows a trauma to the left eye of the vegetative matter. So listen, and on examination there is a corneal ulcer which has a soft and raised creamy filtrate. So ulcer is feathery and showing an hyphae, branching aseptate hyphae, and satellite lesion is also there, and corneal scraping shows a sickle shaped macroponidia. Okay, so first, he is a farmer and he is an immunocompetent patient, and there is an aseptate hyphae and sickle shaped macroponidia. So always remember, whenever there is a term sickle shaped macroponidia, it is nothing other than the fusarium. Okay. So what are the other factors? It is so this fusarium can occur in immunocompromised, immunocompetent, in both the patients. So here the clue, it is a sickle shaped macroponidia. So the here answer is fusarium. So it is a hyaline filamentous fungi which usually causes an opportunistic infections, and it also causes an onychomycosis, keratomycosis. Okay, so diagnosis is mainly by sickle shaped macroponidia. So here a patient following the use of contact lens developed a corneal ulcer and conjunctivitis, shows in polygonal cyst. What should be the probable diagnosis? Yeah, acanthamoeba, Naegleria, entamoeba and giardia. So here the answer is, yeah, acanthamoeba. So today questions all are clue. Okay, here contact lens means it is an obvious, it is an acanthamoeba. So this acanthamoeba keratitis is usually associated with the corneal injuries. It is usually because of the contact with any that is a contact lens, or if you are using what is a lens wash solution which has been contaminated with the acanthamoeba. So here the risk factors are the extended wear of lens, and it will be chosen whenever there is any, if you are doing any procedure, if there is any default or any breaches, and if the swimming with contact lenses in place, swimming pools are mostly, it's a high risk factor, and use of homemade saline solution which is contaminated with an acanthamoeba. So today questions overall, I think it's a clue form. Okay, so I will be recalling at the end. So milk ring test, yeah, it's a straight question. It is a test for brucellosis. And coming for tuberculosis, any test you know is, yeah, it is a Mantoux test, and for salmonella it is a Vidal test. So just for a recall and just to brush up, I have mentioned all the tests, but there are n number of tests for the bacteriology, and I have posted some videos like test in microbiology in my YouTube channel. If you want, you can go and revise that. Okay, so it is very useful for the MCQs. So the main aim of an adjuvant is to increase the distribution, absorption, antigenicity, and metabolism. Yeah, it is an antigenicity. Okay. So the adjuvant is a substance that usually enhances the immunogenicity of an antigen. So what are some of the examples are? So the component called as an alum, and then fruit, and the bacterial lipopolysaccharide. These are all the examples of an adjuvant. They can also ask only the examples also. Okay. So here some of the clue I want to say. Just remember. So if it's a candida, what they have mentioned, that's a pseudo hyphae, and the germ test will be positive. Okay. And if they are coming for second question, we discussed about cryptococcus, right? So for that, it is an cryptococcus, there is no pseudo hyphae, and CSF sample have been given. And for fusarium, it is a sickle-shaped macroconidia, and it usually causes an eye infections like any keratitis or any corneal ulcer, whatever it can be. And so coming for what's the next question is acanthamoeba. You know, no, right? Always the contact lens. So contact lens user, if they develop any corneal ulcer or any infection, it is always acanthamoeba. So these are some of the key points you want to look for the questions. If there is this point, yeah, then you can mark it as an answer. Okay. So thank you, friends.